Hello? Everybody here? Okay. So let's see here. Okay, yeah, go ahead and keep your, if you can keep your mic muted unless you have a question. Actually, I kind of like this format because if there's any, we could decide whether these Q&A part would be published depending on the content. So, and I went to a different computer because the other one's still processing the recording, and I didn't want to start the next session without maybe possibly messing that up. Okay, so I don't have, actually, I completed my meeting notes. I guess we can go into a little bit more about like why it works and so forth, but I thought I would just leave it open to whoever has questions. I don't see everybody on here yet. Oh, there's Angie. Okay, hi Angie. So I'm going to mute my mic. Well, I'm going to mute it, and then I'm going to wait for someone to ask a question, whether it's going to be in the chat. How do I get the chat? Well, okay.
Can I just jump in here with a question then, Paul?
Absolutely, Paul.
Okay, great. So like the technique that you gave us, like the 3 times for 10 to 12 seconds, like applying large amount of pressure, so is that a fascial release technique for the perineum?
Yeah, well, so what I would say about that is that it's based on the vibrational fascia release fundamentals. We don't teach, as a matter of fact, this has never been taught before. I'm not even sure that, frankly, any of the trainers know about this technique. It's just something that was shown to me. And so, for various reasons, we don't go over this in class. So I wouldn't call it a vibrational fascia release technique, or it's based on the principles, the very same principles for everything else we use. In other words, it's another part of the body, and so why this works. Also, the people that I have shown it to have reported a release in the area. For anybody that does any somatic type of meditations and can feel, especially for those that can do somatic type of meditations and feel, the different parts of their body, the tension of their body release, they'll feel, they can, like you can, you could do this from the inside out, from the outside in. Well, from the outside in, we're using the tuning fork, and then from the inside out, you can start releasing tension in the area. Some of it is somatic, and some of it is actually from our own minds creating, the tension, or both. I don't know. Did I answer your question?
I guess so. So I guess results of this technique, like that tension release, what are some of the results of that you've witnessed?
For what? Okay, so depending on the person's situation, whether they're far into their journey with their prostate, where they already have some factors that are really hard to turn back, which is what happened to me, and I ended up for a HOLEP laser procedure about 2 years ago. I wouldn't say that you're going to turn something back that's really far advanced. Okay, but in terms of relief, what we're doing is release and relief, and restoring flow. Well, ultimately, a practitioner is here. My view is that with tuning forks, whether it's biofield tuning or anything else, it's a restoration. Ultimately, the cause is a restoration of flow. And so we're putting flow back into the area. We're moving certain fluids out that don't need to be there. We're releasing tension in the area. We're releasing fascial restrictions in the area. There's a lot that's going on there. And whether it's the bladder, because, a lot of it, what's really mainly attended for men's prostate issues are the very first thing that men realize is start noticing something's not quite right, is changes in bladder. To what degree, that there's a change in the bladder? Well, prior to my procedure, I was having panic attacks on airplanes. So I knew I needed to do something about it. So back to what you're asking about. I think that this is something to develop a community of men and doing this with, and then sharing with each other. Because I have my own personal experiences where I can release, I can feel the tension building up and it releases. And I can also notice changes in frequency of urination, things like that. But I think that in order to have a practice, you need to have a community. And there is no community, there is very little community for men with prostate issues. I would love to see one. I think that I would probably lead most of my other online communities and join and do something like that, just because of how important it is for men. I would still do vibrational fascia release, but that's about it. I think it's a really important issue for men, and I would love to see it. I don't necessarily have the time and energy to put one together myself, but I think if you have guys talking with, doing this and doing, doing this as well as other things and having discussions, I think that would be very healing, and then we could develop some practices. But if you have more specific questions, Paul, about what it could do, I'd be glad to go over that with you. If I'm being too general, I can only be speaking from my own personal experience. I am hearing that men are also having some changes in length of erection time, but I don't really want to go through that in this particular format, but I am noticing, there are men that are reporting changes, but this is all privately, and this is all, anecdotally, nothing scientific.
Right. I mean, I guess that kind of feeds into a little bit of what you were saying, like a community to talk about those issues. There still seems to be a bit of, stigma and resistance, and,
Right.
sort of acknowledging that we don't acknowledge it kind of
Right.
attitude around these things. Yeah, well, okay, so I guess just sort of on that issue a little bit, like last night's tuning, Andrew McGilgraith, I can't remember his last name, but one of the practitioners did like male anatomy tuning under like the Biofield tuning store.
Right.
Like one of the group sessions, and I attended that, and that was quite interesting. So I think it's kind of like a combination of the physical application of the weighted forks in these areas, like be that the perineum, be that in other places, as well as dealing with, like sacral and root energetic issues. I think that kind of manifest emotionally, spiritually, mentally, that kind of thing.
Okay, so without going in, it's great you're bringing that up. So without going into it too much in this session, I would be glad to do other Zoom sessions talking about this stuff. But on a very, because I've seen that, and I've seen in our original chat on a Biofield tuning group, someone was mentioning about resentment towards women and so forth. And my response to all of that is it depends on the level of cause and effect that you're operating from. And so there's conversations to be had about what level of cause and effect that one is operating from, and and then to what degree that has an effect specifically on an area or even the whole body. And so what I mean by that is I've been doing Dzogchen practices that not specific to that area, but I noticed that a full release occurs with that. So that's from the inside out. And I think that, those are the kinds of conversations to have in a community about, what are the kinds of things that you do, whether it's a meditation or a practice or, but I'd like to, on the inside out, I'd like to take it out of the realm of conceptualization, because I think people get caught too much in the conceptualization and less into just being aware of what's going on and then following the rabbit down that hole. I think that you can get a lot more done efficiently by doing that, but it's not meant as a criticism. It's just how I roll. And for example, in my biofield tuning sessions, I don't do as much talking. I work with the client on doing more of a meditation called natural liberation. I still do the biofield tuning, but I do it just do it differently. I don't do a whole lot of narrative. And I still get reported, crazy, great stuff going on. So I think it just depends on where you're coming from, what level of cause and effect you're looking at.
I would agree with your sentiment there. Like, I don't, I guess maybe I'm not overly sensitive enough to like hit the fork once, hit a patch and tell you exactly what's going on there. That's not my level of sensitivity. I'm coming at it more from stress relaxation, maybe a little bit of like guided meditation, hypnosis standpoint, and, much more of a visual approach, visualize that channel of energy coming out through your heart chakra or whatever, if we're doing like a front chakra release, as opposed to just me reporting every single thing I'm encountering. So I think that depends on the tuner.
It's whatever works for you and your client, of course.
Yeah.
And so,
but again, like you said, still getting results. So I don't think it necessarily has to be the to this. It's probably going to be a combination.
Yeah, I'd love to hear from people about how this works for them. I mean, for all that I know, a woman can do this. I don't know what kind of results that they would have, but the perineum is still the perineum. It's just what's under there that's different. And so, it's an area that people usually don't. I mean, I'm not going to be doing. There's going to be very few people, that I would do this for. There's many people I would show it to, but for self-care, and I'd love to hear from you or anybody else after a few days trying this, 3 times. You can do it more, but just to get you started. Any questions, whatever. Anybody else have any questions? And Paul, please, I'm not trying to stop you from asking questions. I'm just opening up you're welcome to ask more questions, just opening up the.
I have another one, but someone else.
No, go ahead. It seems like everyone's happy for you to be jumping in.
Okay. So you had mentioned using specifically the 128 between 144, and you're still testing out the 144. What have you tried using the combination of the 54 and the 62, like trying to bring that?
Well. Okay, so this isn't biofield tuning, okay? I just want to, for all of you folks that might be watching this video in the future, I'm not comparing biofield tuning with vibrational fascial release. We're talking about best practices. I know I already did some. There's one person, there's actually 2 people in here already. No, 3. There's 3 people in here that I have brought out the vibration meter and we looked at it. And, maybe I can have someone help me kind of do a little video about like what you're looking at on the vibration meter. But you're looking at that peak to peak movement, right? And also looking at that times time, or that times the hertz, and how much movement you can accomplish. So if you can go back to that discussion, which I didn't go into at length you would maybe start to understand a little bit why we're using more of the 128 hertz, the 136, rather than the 54 and the 63. In terms of best practices for vibration therapy, and it's not just best practices for the client, it's best practices so we don't get repetitive stress injury. It's putting out less vibration Oh, and there's one other thing, by the way, which I didn't go into too much. We use, in vibrational therapy, we're using the short fork, the short stem. And all of the other the forks that you mentioned, Paul, are the long stem. And the reason why we use the short stem for just about everything is, again, because of the amount of pressure leverage that we're using. And again, if you go, if you go to a class and you can bring your fork, your long handle fork, you can try it, you can see how much. But in the last class in Costa Rica, I'll give you an example. I'm not going to mention who it was, but there was someone that was trying to do some release. I think it was on the client's leg. And they were doing it, and this was with a 128 hertz, and they were doing it like 3, 4, or 5 times. And they called me over and said, well, I'm not feeling a release here. And so I just activated the fork, went right in. Of course, this was their first time in a class, so you don't expect them to have mastery of it, right? Went right in, boom, there was a release. So we went to the vibration meter, and we did a little clinic, had them show them what they're doing and how they could accomplish more vibration towards the end of the fork. So this is not just, how would I put it, some new age stuff where we just want to get vibration at the end. Actually, it's very specific. And I'm probably over talking the answer to that, but it's really about best practices. And it's not about whether one is a better fork or not. Okay. Any other questions? I can't see the chat, so in this particular box. So if anybody has a question, they're going to need to just go on their mic.
There was one question.
Okay.
Angie asks, can this technique help with hemorrhoid condition in an elderly person?
Wow. I don't know. I mean, we're in this one, we're going into the perineum. I'd have to think about that, Angie.
Excuse me.
Go ahead.
Paul.
Yeah.
Can you hear me?
I can hear you, Nancy.
Oh, the answer is yes. From my personal experience, yes, it will help hemorrhoids.
By the way, Paul and everybody else anybody who does not know Nancy and Larry, Nancy and Larry have vibrational fascia release training of Costa Rica. They live near Tiburon, Costa Rica, off of Lake Arenal, and are great teachers and great practitioners, and we have lots of fun working together. So I just wanted to introduce Nancy while she's talking. Please take it away, Nancy.
That's all I have to say.
Come on,
I mean,
please.
yes, it works. Well, you just have to do it. I wouldn't do it more than 3 times a session, to strike it 3 times, put it in the same place.
So where would you, with regard to hemorrhoids, what are you talking about? Are you talking about?
The hemorrhoids are going to be coming out this way.
Yeah.
With skin hanging, little balls.
Right.
Usually. Sometimes
Right.
they're flat, sometimes they're full. So I just take that fork and put it right on the little ball.
Okay, so we're not, okay.
Right on the hemorrhoid.
Just to clarify, this is cool. Actually, this is great to know. So what I'm hearing you say is that you're not putting on the perineum. You're going straight, you're taking a direct route to the hemorrhoid.
Right there.
And you're placing the bare foot on the hemorrhoid.
Sometimes, you might want to start with the 15. There's that little sharp edge on the bottom.
Paul, what she means is the 15 millimeter gem foot. Okay,
right.
Continue.
It's small and it's a little rounder, and it seems to deflate and give a very soothing, non-burning, sometimes they burn and they itch and they just feel terrible.
Right.
And you can't do it. My mother used to say, if you could just put them back up inside, they'll feel better. Well, it's very difficult. You're smirking. It's very difficult.
I was thinking of things my mother said. That's why I was smirking.
Ah, see. yeah, it's very difficult to take something that's way big and try to put it back where it belongs when it doesn't fit there anymore. You've got to give it a little relief. Try it.
Okay, so we're still talking self-care, right?
Right.
Yes.
Okay.
Yes.
Yeah, it would be a
Yeah.
rare,
And then, you know, if you once you feel like you've got control of the fork and you know what's going to happen and where you're going to place it and how much pressure. I don't put a whole lot of pressure. You just want it to, I like the little term of kiss there, you know, just kind of give it just a little attention with that fork and you'll get some relief.
yeah, Nancy tends to be very, very gentle in her initial application, and I've learned a lot from her. For self-care, I find that my body likes me to just go straight in and just kind of, you know, go for it in terms of like the pressure. And so I think Nancy's counsel is very apropos for those that want to just start off gentler. I mean, even now that we're talking about this, I mean, you could even go into the perineum with a 15 millimeter. It's a very small, don't do the 6 millimeter, but the 15 millimeter is fine to start with, so that if a person wants to become acclimated to using it, that's fine. But it's all about self-care, so it depends on what one is happy to use first.
Right.
So you're by the way, I have you know, I have sweatpants and underwear on. I don't have to be naked when I do what I was talking about. So and I tend to, and I what's that?
I don't. I just go
so
straight.
so with regard to self-care for hemorrhoids, would that be with clothing on or underpants on, or?
I don't. I go straight to the skin.
Okay.
I mean,
There you
that's
have
just. And something else, Angie said something about older people. My hemorrhoids came on when I was 18 years old. So it's, yeah. So I'm very glad to have this self-care with the foot at 72.
So Nancy, tell me, since you're being so upfront about your situation, may I ask about how long? You probably already said something to this effect, but after about how long? How many activations of the fork does the hemorrhoid sort of
Feel better?
Yeah.
2 or 3. It doesn't take long to get some relief.
Does it go away eventually? No. Okay.
Mine have never totally gone away. Sometimes they're better than other times.
Maybe another question, okay, so my follow-up question is, if it doesn't go away, do you notice that after you activate the fork in the area on the hemorrhoid, that it takes longer for it to come back and bother you?
I don't know, because
Okay.
it just depends, Paul. It just depends on what you eat, what you drink,
Yeah.
how long you sit, where you're walking. There's so many things that.
Yeah, I got it.
And I've never thought about how long was it since I last did this.
Good. Yeah. No. Good answer. Yeah. There's really no specific answer to that question.
Yeah.
Okay.
As needed.
Okay.
As needed.
Yeah.
There's no pain by number.
I would like to say that introduce Ileana. Ileana is our translator for our classes here in Costa Rica.
Hi, Ileana.
Hi, how are you?
And Angie is
I'm great. Ileana's a great support. She provides very specific translation from Spanish to English and back in Costa Rica. They have it's a great crew down there, and so great to have you folks. I know that Angie's also doing translation. Translators are actually a blessing. I know that in some of my spiritual practices, the translations make all the difference in the world. And so translators are a God's gift to mankind or womankind in my experience.
Thank you. Oh, sweet. Thank you.
Yeah.
Thank you very much.
Be able to communicate. Yeah, absolutely.
Thank you. Thank you.
Okay. Can someone just take a look at the chat for me and see if there's any other kinds of
That was the last one.
what's that?
That was the last one on the chat.
Okay.
And
So, any other comments, questions before we wrap this up? Okay.
I think this is an important issue that needs to be addressed, because I don't know of a single person that gets into an older age that prostate hasn't been affected.
Right. Yeah, and that you bring up an interesting point, because I know that people talk about various like kind of like Louise Hay type of responses with regard to prostate. But and this goes back to Paul, the other Paul. See how I put this. So I come from a ancestry in which my ancestors married their cousins. And so there's certain kinds of proclivities that happen in ancestral lineages, whether on biofield tuning, if you're going to go up the ancestral line, or just simple that I've had so many males in my line that have had this issue that one could say it's hereditary. I don't know. It could be a combination of things. So I think these are things to also be touching upon, relative to the levels of cause, because it's not just the individual body, this body. There's also all the various male bodies in my ancestral line, and there's a number of different ways, as you probably know, to approach that. So I thought I'd bring that up as something else having to do with that issue. I could say more. But... So Larry, you going to try this?
I have tried it. It works well.
Okay. Could you say a little bit? I'm putting you on the spot, but can you say a little bit more?
Well, before I've had the operation, but it's still, you have trouble urinating or whatever. Mm-hmm. And using the fork, it relieves the pressure a lot. It helps. You feel it deep inside, so it helps. It helps. That's all I can say. Is,
Okay. Well, thanks.
As well as physical, it helps mentally. Yeah. If you're feeling better, then your mental outlook on everything gets better. But when something down south is not working right, we all get a little
testy.
So this,
Yeah. There's more to say on the issue, but I think it goes past what we're probably doing the session for. But you know what? I'm gonna, Paul, feel free to ask another question if you want. Not that I want you to, but I think we're gonna leave it to you to bring up the rear, so to speak. The pun was not intended. That was my father coming through again.
The only other comment or whatever, the only other thing I have to say is, you mentioned creating like a group and a community around this. What do you see that looking like? Do you see that looking like maybe a Facebook group specific to this issue?
Yeah, I can see a Facebook group. I just don't want to do it. I mean, I would be glad to participate in one, but I already have, 4 groups I'm an admin of. I might actually, I already have 2 pages I'm an admin of. I have a Skype group that's been going for like 5 or 6 years. These are all different subjects, by the way, that I'm an admin of. I'll pull back eventually, but someone else needs to take charge In other words, I would be glad to help out as much as I can. I would promise before they start this group, I would promise them that I would pull back from some of my other endeavors and participate in that, because I think it's a really important issue for men, and I think it's just really safe and easy ways to talk about this stuff. That it's just just matter of fact. It doesn't have to be all this other stuff. So what do you think, Paul?
Yeah, I mean, I think I'd be willing to create the page and just manage the admin on it, and bring in. I think you've got a little bit of a bigger network around this than I do.
Oh well, I would certainly advertise the group, but here's the thing: I think it should be a closed group, okay, a private group.
Yes. Yes.
And then you will need to decide whether it needs to be a group, not a page, because you can't make a page. Pages in Facebook are public, and I think it would be
those are big businesses.
Yeah, I think it would need to be a private group so people feel free to share, and especially talk about any possible controversies. And I would advertise it on all my other groups, and I would actually be mentioning to them that I would be pulling back a little bit to help get this thing started. And I would advertise the group in there, but I would not even want to be only as a possible backup admin, but I would not want to be the admin on that group. And I would not want to put the other thing I'm concerned about, frankly, Paul, is that we've already been in a controversy with an admin of another group, Nancy, Larry, I, and other people, where let me see, we're trying to pull back from controversies, and we do not want to make it appear like we're pushing a particular method, that we're promoting our method. So that's why I think it would be better for the issue at hand. My father's name is Eli. Sorry, Eli came through again. For the issue at hand, that it's got more of a neutral situation, and you or some other guy would be it. Then you would also need to decide whether to make it men only or leave it open for men and women. It's totally your call. That doesn't matter to me.
I mean, I guess I think at this point, because I think there's a few things to navigate here. There's sort of the sensitivity of the issue. Like you said, that can lead to controversy. I don't know the backstory about what you were mentioning, but I could see this being like I could see this being like maybe a healers or like practitioners focused group for now. At least maybe, I don't know, like developing. I don't want to say techniques. That doesn't really sound right.
Right.
But maybe just building a little bit of a database first, and then figuring out where to go from there.
You know what? That's a really good idea. But again, I don't. I'm involved in some other research projects, including nothing having to do with health at all. And so I'm at my max right now.
Right.
But if you or some other people want to do that database, I would be glad to contribute. I just don't. My organizing capability is at its limit. So I would provide support, but I would not do the actual organizing. And
okay, well, I'm willing to help get it started. And then, just from a community standpoint, like, I'm not an expert in this field by any means. So my, personal content and contribution that way is limited.
Well,
but, from an administrative standpoint, I can definitely.
But the thing is that none of us are quote unquote experts. I mean, Nancy, Larry, and I were not experts in vibrational and fascia release. By the way, our meeting is going to give out in just a few minutes. So we're going to wrap this up. So these are good points, but none of us are experts. We don't put ourselves out as experts. We're all citizen, laymen, laywomen who are, we're answering questions for ourselves. And I can go into on another Zoom session about what my experiences were with Mayo Clinic and surgery and dealing with the urologists and stuff. That's a whole other thing, and I could do a Zoom session just on that for the new group, right? So, I think there's a lot of material already there, frankly. And I'd be glad to start it off with a couple of Zoom sessions as well. So, whatever you want.
Okay, well then, why don't I just create the group?
Okay.
I'll get that set up. I'll invite you as an admin as well, or moderator, or whatever, there's all the technicalities with that. and then allow like your network to connect
Yeah.
with you to connect to that.
And then you need to, the first thing you'll need to decide as to whether to make it for one gender or for both, or for multiple genders, depending on how people view things. But, just, that's your decision, Paul. I'm going to stay out of that one.
I mean, I think I'd make it open. Again, I think just having from like a practitioner standpoint,
Right.
like other technique, to me, it makes sense to just keep it open to that. Like, why limit yourself at this point? I mean, I would say it's maybe a little more male-focused issues, but open to anyone.
Yeah, and I think also making a point that this is not to promote any specific agenda or any specific technique, but about leaving it open. I think that's going to be really important moving forward, because let's say you start sharing something like that in the Biofield tuning community, and there's an overemphasis, for example, vibrational fascia release, those admins will get complaints right away, and rightly so. I mean, I kind of stepped over lines a couple of times over there. I already have communicated that directly to the admins there, so it's no great secret. And so I think it's just important being open, upfront, just saying what it's about. So, it was great talking with all of you. Appreciate all of your input. I think I'm just going to go ahead and end this session, and have a great day.
Oh,
That's
Thanks so much, Paul, for your time.
Sure.